what are those tactile functions or characteristics that makes a good residential adolescent treatment program, whether it's maybe addiction or otherwise.
Yeah. Yeah. I mean, I think it's hard when you're a parent and your kid and you're like watching your kid take crazy risks and, kind of devolve and be unstable. It's really easy to be taken advantage of because you're in such a state of crisis. So I think everybody kind of needs to know what to look for in facilities because they are not all the same.
No
and, it's kind of like, I mean, you're a little bit of a systems theorist and, I really kind of, look for those kind of themes too of any system can become toxic. Any system can be corrupt. So what are the things that we can actively do to make sure that we're not becoming corrupt? So I think things like in a healthy system, it is a place where I get my needs met, right? Like basic safety needs. A healthy system is one that's adaptable, is one where I can disagree and challenge and still be respected. So those are some of the characteristics of a healthy system. I do think that when it comes to the treatment industry, we have to be cautious about greed and our egos and some of the kind of human, psychological constructs that we all suffer from that even really well-intended people can do harm if they are not, if there aren't a system of checks and balances against some of these features. So, yeah. So one thing is, you and I have the privilege of working for a not-for-profit, which means that you and I know all the money that we are making is going back into providing more services and more care. Mm-hmm. But that is not the case for every facility. Mm-hmm. Some facilities are a private facility where you are kind of making someone wealthy in the process of getting treated. And so there's an extra measure of accountability that needs to be had to make sure that greed is not corrupting that system.
That's interesting.
You know what I mean? Mm-hmm. So what kind of incentives do your admissions staff get for bringing in people into care? Because if they get financial incentives to do that, then what's the likelihood that their integrity is compromised and they're bringing kids in that aren't necessarily right for their services? It just, so you have to create balances and check systems for those.
It can be challenging.
Yeah.
It can. What I hear you saying more than anything else is even a great program can have a bad day. So what does that really mean? What do I really mean? You could be a nonprofit. Mm-hmm. You could be accredited.
Yes.
We could talk about what that means maybe if we see fit. You could be fully staffed and overstaffed to the guidelines outlined in your state, because we do have rules and regulations associated with the licenses that we have at each one of our service locations, inclusive of the Arch Academy location. We could with all of those things considered, a CA or a milieu staff management, a frontline staff person who's responsible for the well-being of these kids in any given day, or a counselor or a case manager could experience transference or something else is going on in their life. Who cares what the excuse is, but they could make a poor decision that's going to negatively impact a kid in our care. So it's a higher responsibility. And you're right, your organization needs to have really good feedback loops.
Yes.
Whether that's financial or performance or culture, in order for folks at all levels of the organization to feel heard, seen, and safe to because sometimes we need to really watch out for this is, can someone speak up if they see something that they interpret as incorrect or invalid?
Right.
And who can they speak to, and is there reliability that message will be heard?
Yes.
But I agree with you, even quote good programs can make mistakes and have a bad day.
Yeah.
This seems in particularly interesting. So before we move on, the characteristics of a good program, though, to be sure, like for anybody that might be making a treatment decision, is the financial status of the organization, which if you're a nonprofit, you can look that information up online. It's publicly available, usually 2 years back. Are they accredited?
Yes.
By a reputable national accreditor associated with that space. So in behavioral health, one of the gold standards is the Joint Commission. Mm-hmm. Do they have state licensure? That's always like super important to check for. Because to do this work, if you identify yourself as a especially for addiction treatment, as an addiction treatment provider, you have to have a license for that. Yeah. The other thing that I might look for, Laura, I'd be curious what you think about this, is are they a network with an insurance company?
I mean, that's
because
that's part of it, I think, is that with the growing support that we have had in the mental health field from insurance and the collaboration between addiction specialists, like in our line of work, we're dealing with primary substance use disorders and, common co-occurring issues. But even if I'm just a primary mental health focus, there's criteria. And so we've had better communication between providers and insurance. ASAM, which is the kind of medical criteria for determining level of care. Those kinds of systems also provide a checks and balances. We have to prove our clinical hours to the insurance in order to get reimbursement. ARCH deals with a lot of insurance-dependent families. And so, that is kind of some built-in protections, but that's not to say that there aren't some private facilities that aren't in network that are also not, doing good work.
No doubt.
But it is kind of it's a little bit of a flag for me when someone's like, yeah, no, we're not going to contract with insurance anymore. 'Cause, then I'm kind of like, well, why?
Exactly.
What are you wanting to avoid?
Because it's work.
Yeah, because it's work. Yes. And it's, there's a lot of documentation. There's a lot of, when we do these reviews with our kids, the insurance companies and we are both talking about their progress and their internalization of the skills we're teaching them, which is like a totally intangible thing. It's like, how do we know that they're internalizing these skills? And so we have treatment goals that they're a part of designing. That's kind of another thing, is like, how is your teen program engaging your teen in collaborating on the treatment plan? If I have like a system of treatment that just dictates care to a kid and says, this is the measure we want you to meet, then my program is designed for compliance, not for collaboration. And, kids are they're already really disempowered in their lives because they're minors. And so you have to take extra care to make sure that you have a way to engage them in the treatment process and help allow them to shape their treatment goals. And like you said earlier, kind of like feedback of, hey, this approach doesn't work for me. And then it's up to you as the treatment team to find a model that works for that kid, not the other way around.